Thank you for choosing UC San Diego Health. We are committed to creating a healthier world, one life at a time, through new science, new medicine, and new cures. The day before your surgery can be an uneasy time. This video was created to provide you with information you and your family will need to know. Following the instructions provided will help decrease the chance of complications during your surgery and recovery, and you'll know what to expect before and after your surgery. The night before surgery. Please follow any bowel preparation instructions given to you by your surgeon. Review your instructions for surgery, including nothing to eat or drink after midnight the day of surgery, including gum and candy. What medication to take or not take, and any instructions specific to your surgery. If you are told to take medications on the day of surgery, you may do so with a small sip of water. For some surgeries, a preoperative clear liquid drink is allowed 4 to 6 hours before surgery. If you're a candidate for this, your surgeon or anesthesia provider will let you know. You will need to shower or bathe with a special CHG soap and shampoo. Rinse thoroughly. Use a fresh, clean towel to dry and put on clean clothes. Make sure you have made an arrangement for an adult to drive you home if you're scheduled to go home on the same day. If you have a cold or fever or any other condition, please inform your surgeon. Your surgery may need to be postponed. After hours or on weekends, contact your surgeon by calling UC San Diego Health Message Center at 858-657-7000. You will need to arrive at your scheduled check-in time. This is usually 2 hours before the procedure is scheduled to start. The day of surgery. You will need to shower or bathe with a special soap called CHG again before coming to the hospital. It helps to prevent infections. Use a fresh, clean towel to dry and put on clean clothes. Please remove all makeup and nail polish. The doctors and nurses need to be able to see your natural coloring. Wear comfortable, loose-fitting clothes and low-heeled shoes. Tops that open in the front are easier to manage after surgery. Please leave valuables at home, including jewelry, credit cards, and money, except for what you need to manage your copays and for discharge medication. Jewelry, including all piercing, watch, glasses, contact lenses, or dentures, all must be removed before surgery. Remember, an adult must come with you to the hospital to drive you home. You may take a taxi or a bus home only if a responsible adult will be able to ride with you. Your surgery will be canceled if you have not arranged this. You will not be able to drive for at least 24 hours after the surgery. Arrival and check-in. Please arrive at your scheduled check-in time so you'll be ready for your surgery at the scheduled time. If you think you may be late, please inform the pre-op unit as soon as possible. Please be aware that all visitors are required to pay for parking. Your driver will need to park in one of the lots next to the hospital. Valet parking is available in front of the main entrance to the hospital. When you arrive at the hospital on the day of your surgery, please check in at the designated area. You will be asked to show photo ID. Your copay or deductible is required on the day of surgery. We accept cash, check, or credit card. The receptionist will then direct you to the preoperative area. In the preoperative area, you will change into a hospital gown. Your clothes will be stored in a bag which will be returned to your family or stored in the locker. 1 or 2 of your visitors are welcome to stay with you during this time. No children under the age of 12 will be permitted in the preoperative area. Please respect our quiet zone policy by silencing cell phones and keeping conversations at low volume. The nurse will measure your vital signs, insert an IV into your hand or arm, and make sure all necessary tests and information are available and correct for the surgery. If you are a candidate, your epidural or peripheral nerve block will be performed in the preoperative area prior to your surgery. The anesthesia provider, surgeon, and operating room nurse will meet with you. All of them will ask similar questions just to make sure everything is correct. Then you will be taken to the operating room for your procedure. Pain management. While we cannot make surgery completely pain-free, your doctors and nurses are dedicated to decreasing your pain following surgery and making you as comfortable as possible. Here are some of the ways we use to control your pain. Pain injections. These are given through your IV catheter or intramuscularly before you're able to eat or drink. Pain pills. Once you're able to eat or drink, your pain may be treated with oral medications. Patient-controlled analgesia, PCA. This will allow you to administer your own pain medication through a machine. Epidural pain control. This is provided through a small plastic tube which is inserted in your back in the preoperative area prior to surgery and will provide pain relief for patients having lung or abdominal surgeries by using numbing medication. An anesthesiologist from the acute pain service will speak to you before your surgery if this type of pain management is appropriate for you. Peripheral nerve blocks. These are used to provide pain relief to a specific area of your body, usually for arm, leg, breast, or abdomen. An anesthesiologist from the regional pain service will speak to you before your surgery if this type of pain management is appropriate for you. Once you're in the operating room and before the procedure begins, many people will be getting you ready and preparing equipment in the room for your procedure. If they need you to move or adjust your position as part of the preparation, they will ask you to do this and explain why they are doing it. During surgery. Relatives and friends will be instructed to wait in the surgical waiting area. Please designate one contact person for information. Your contact person should tell the receptionist or the pre-op nurse where they will be waiting and provide the cell phone number if they are leaving the area. Your visitors should be aware that the length of time scheduled for your surgery is an estimate. There are many things that can change the length of surgery. Updates during surgery are sometimes difficult to provide, but we will do our best to keep you posted on how your loved one is doing during surgery if you provide a functional cell or mobile phone number. After surgery. After surgery, the surgeon will contact your designated family member or friend to explain the surgery information. Usually 20 to 30 minutes after the surgeon speaks to your contact person, you will be transferred from the OR to the Post-anesthesia care unit, known as the PACU or PACU. There you will recover from surgery and anesthesia. Recovery in the PACU. The PACU is one large room with many patients recovering at the same time. Each patient is on a bed or gurney in a cubicle, which can be draped for privacy. All patients are monitored closely by their registered nurse during this time. Each patient has, at the minimum, an IV and continuous monitoring of blood pressure, heart rate, and breathing, which require cables from the patient to a monitor screen. Sometimes there may be drains, additional tubes, ostomy appliance, or other devices attached. The process of waking up from anesthesia is not the same for every person. Nausea and vomiting are a common side effect of general anesthesia. However, medicine is available to the nurses to treat it. Information for visitors in the PACU. Family members and designated friends are welcome to visit their loved ones in the PACU. Visitations are voluntary. The PACU nurse will contact the family member when the patient is ready for visitors. To help us ensure the safety, comfort, and privacy of all the patients in the PACU, the following guidelines apply. Only one visitor at a time. Children under 12 years of age are not allowed to visit in the PACU. Please silence all cell phones and respect the quiet zone area. Stay behind the curtains and within the cubicle of the space of your loved one. Food and drinks are not allowed in the PACU. Please respect the judgment of the nurse if a loved one is asked to leave the PACU for any reason at any time. Please respect the privacy of the other patients while in the PACU. We ask that you please not share information that you may accidentally see or hear about any other patient. Please inform the nurse if you have a history of fainting. Your loved one may have tubes or machines attached to them after surgery, and this sight can be upsetting to some visitors. The PACU nurse can answer your questions and address any concerns you have about the patient's recovery from surgery. Your contribution and cooperation to the care of the patient is greatly appreciated. Together, we will provide the best possible care to our patients. If you are going home on the same day, when you are awake and ready for discharge, you will change into your clothes. The PACU nurse will review your discharge instructions and medications with you and your visitor. Your visitor may be asked to pick up any prescriptions before discharge, and when ready for discharge, you will be escorted in a wheelchair to the pickup area. Because the effects of your anesthesia or medications will not completely wear off for about 24 hours, we strongly recommend the following for the first 24 hours after surgery. Have an adult stay with you. You will probably feel tired or sleepy the rest of the day. Take only medications prescribed by your doctor. Do not eat or drink anything containing alcohol. Start with a liquid diet and soft foods, as tolerated, before returning to your normal diet, unless you have been told otherwise. Do not drive a car or operate heavy machinery. Do not make any important personal or legal decisions. If you have any concerns about your medical condition after you have left the hospital, please contact your surgeon by calling UC San Diego Health Message Center at 858-657-7000. If you are admitted to the hospital after surgery, if your doctor decides that you need to stay in the hospital after your surgery, you will be moved to your hospital room after your recovery in the PACU. It can take up to 2.5 hours before a room is available. During your hospital stay, there are several important activities that will benefit you with a better recovery. Taking deep breaths or using the incentive spirometer, a device that helps you take deep breaths, will exercise your lungs and help prevent lung infections like pneumonia. Early activities include turning side to side in bed, ankle and foot rotation exercises, and walking in the hallway. All of these will promote good blood flow and prevent blood clots. Thank you for watching this video. Being well informed and following the above instructions will ensure the best outcome.